Welcome. I'm Dr. Heidi Creighton. I'm from the MS Center of Greater Washington, right outside of Washington, D.C. in Northern Virginia. I'm an MS neurologist, and I'm incredibly thrilled to be here to be part of your summit. And I hope that we're kicking this off with some good information for you, and the rest of the summit will be really, really enjoyable for you as well. So my task today is a little bit of MS 101, a little bit of education, just to kind of get you primed for your summit. And I always like to start off by just kind of, again, MS 101, talking about MS diagnosis and how we get there. Sometimes people are diagnosed pretty quickly. Sometimes it takes a little bit more time to really seal the deal on the diagnosis. But signs and symptoms really come from you. So it really starts with the history and the story that you tell to the neurologist, to tell us about what has happened to you, what symptoms you've had, how long they were present, whether things went away or didn't. But there have always been just two requirements for a diagnosis of MS: that we have something involving the central nervous system, which means any part of the brain, any part of the spinal cord, and things that occur separated in time and space. And what that means is occurring in different parts of the central nervous system, so different parts of the brain and spinal cord, and having things that happen more than one time, so that by definition, there's something that shows it's an ongoing process. And people can really reach those two check boxes, if you will, either clinically or by MRI. So clinically, if somebody has something happen, for instance, they lose vision in their left eye. If they came back to the neurologist 6 months, a year later, and they said, again, I have blindness in my left eye, they'd be told, well, you check the box on having something at a different time, but not a different place. If they came back 6 months, a year later, and they said, my right arm is numb and tingly, they would be told, okay, you have checked both of those boxes. Now with MRI scans, though, people can have their first event of funniness, and the MRI can show us that there are spots in different places. And if some things light up with the IV contrast and others don't, we know that they were created at different times. So now we can actually confirm the diagnosis much sooner. So we do MRI scans of the brain, spinal cord, and then sometimes spinal tap as well. And a spinal tap can be helpful if it's abnormal, but if it's normal, it doesn't necessarily mean that you don't have MS. Here's some pictures of MRIs, and this is what we're looking for on an MRI scan. On the MRI, machine, you're laying in one place, but we can kind of get as close to a three-dimensional view as possible. And we're looking for these little white spots that are in typical places, typical location, typical size, to help us know whether or not this is consistent with multiple sclerosis. As I mentioned before, you can have any part of the brain, any part of the spinal cord involved, and that means a whole host of various symptoms. This is certainly not an all-inclusive list of symptoms, and no two people are the same in how they experience symptoms. So it's all about location, 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 just like real estate. And people can have many spots in their brain and have no idea that they have a problem. Sometimes if they just have one spot in their spinal cord, they are pretty aware of it because they might have sensation difficulties, weakness, balance difficulties. If they have involvement of their optic nerve, then they have visual issues. So there's a whole host of different symptoms that people can have. And even when people have the same set of symptoms, they experience them totally differently. And I think that's one of the very, very difficult parts about having MS. People say, gosh, I wish that I could know exactly what to expect. I wish I could talk to somebody with MS and we could kind of share stories and know exactly what to expect. But everybody's MS is very individual. Your MS is really your MS. So people always want to know, what kind of MS do I have? And I think it's kind of an artificial category because it's something that we use for clinical trials, but oftentimes MS is kind of, a spectrum condition. But people do like to know, am I relapsing, some form of relapsing MS, or am I some form of progressive MS? So I think it's important to kind of define those for you. But, having categories are kind of pros and cons, because sometimes it locks you into a little box and until recently, we didn't even have medicines for certain types of MS. And so when we confined people to a little box, then that meant that sometimes there weren't necessarily products available to you. But just because medicines haven't been, necessarily tested doesn't mean that something is not appropriate for your kind of MS. So again, it's really to be used more as a guide. But relapsing remitting MS can be a little confusing for people because people think about cancer and the word remission means gone. And for most people, they always have some reminder of MS, some baseline set of symptoms that are always just kind of there as a reminder. So relapsing remitting MS means that there's stability and unchanging state in between relapses. So a relapse can be either something brand new that is present for at least 48 hours. It can also be an increase in baseline symptoms that you're very familiar with and always have, that are there every day, all the time. But at times of relapse may actually increase, rise in intensity, duration, and be present for X amount of time and then quiet back down. So as you can see on this slide, you may or may not have complete recovery after a relapse, but what's important is stability in between relapses. Secondary progressive MS means you started off like that. You started off with frank relapses, and then you just started to have just kind of insidious or slow, steady change. So rather than being able to say, last Monday I woke up with visual problems, you say, I can't tell you a day that it started. I can tell you I'm different than I was 6 months ago. I'm different than I was 3 months ago. I can't do things that I could do 6 months ago. And when I'm talking to patients, I typically try to think about like holiday season or vacation times. And can you do now what you could do on vacation? If you did Disney last summer, are you going to be able to do Disney this year? Or Christmas shopping? If you were able to shop in the mall, are you going to be able to do that? Oh, no, I have to do everything online now. So that tells me that there's kind of slow, steady change. And primary progressive MS really means never having understanding of what a relapse is, never having a time where something happened and even got a little bit better. It's that something happened, it stayed at the same level that it came on, and you just continue to have change from there. And that's a much lower incidence involvement. 5 to 10% of MS is actually primary progressive MS from onset. So let's talk about some ethnic differences in MS. We talked about it for many, many years that African-American MS is very different than white MS. And we're starting to really understand that more. MS in Black population tends to have a lot more optic nerve and spinal cord involvement. So there's a lot more awareness that there's something going on in non-white MS. There's an increasing diagnosis of MS in Black females, although the incidence in Black males has been actually pretty stable. It's really kind of an interesting data point. There's a need for early high efficacy treatment because we know historically that because of optic nerve and spinal cord involvement, which leads to more awareness of having MS or disability associated with MS, we really don't have time to start off with lower efficacy medicine and then maybe increase to better medicine. It really means starting off very early at the time of diagnosis with high efficacy medicine that is going to have the most impact and really set up a zero tolerance policy for MS going forward. It's also really important for people who are diagnosed with MS to have their symptoms addressed. All of you who have MS, yes, you're concerned about whether or not you have a new spot on your MRI scan, but you also want to know that your day-to-day living with MS can be successful. And that means management of fatigue, of bladder and bowel function, of your muscle spasms, maybe physical therapy to help with balance and walking. But those things are really, really important for your day-to-day function with MS and to be able to function successfully with MS. So we talk a lot, and we've been talking a lot more now about what happens with MS, kind of delayed diagnosis, and whether Black population of MS patients really has some delay, and why that is. Is it because the MS itself is different? Is it because still there's this belief that it's just a white person's disease and it doesn't affect non-whites? We know that's not true. We know that it's less common in non-whites than whites, but we know that Black and brown people do have MS. And again, it tends to be a little bit more involvement and a little bit more awareness by people who are diagnosed. So it means that we really need to work on access to healthcare, um, recognition again that people non-white do get MS, and we need to consider that in the thought process when somebody comes to the neurologist with a bunch of different symptoms, kind of putting that all together. But we spend a lot of time kind of trying to figure out, is there an issue with access to healthcare? And that is certainly a problem. Socioeconomic barriers and cultural trust. Things haven't always been so great with the healthcare system and interaction with African Americans. There's been a lot of distrust, and that's a historic issue. There are also cultural differences, and the way that we communicate with patients, the way that people with MS and their families communicate with the healthcare team. So these are all conversations that are really, really important. And that's, a lot of that is going to be addressed in the summit, and you're going to have a little bit more experience with that. But it's really, really important. And it's really important that you are able to be a part of the conversation and that you are proactive. And if you're here part of the summit, you are proactive. So good for you. Let's talk about kind of what we do when somebody has this diagnosis. So I always say, there's a couple of different things that we have to be mindful of. We're talking about disease-modifying therapy, the goal of which is to decrease the frequency of having relapses, decreasing changes on the MRI scan, and decreasing disability progression, keeping people stable. Sometimes that's not what you want to hear, though. Sometimes what you really want is improvement. And we totally understand that. We totally get that. But our goal essentially is stability. Whatever we get on top of that is, icing on the cake. But we don't want people to talk about the fact that from visit to visit, things are worse. So when I see a patient and I say, "How are you?" and they say, "Oh, everything's exactly the same," I'm elated. I get excited and I'm happy. And they look at me like I'm crazy. But we are really ultimately wanting you to be stable and unchanged. Because by definition, MS is an ongoing progressive condition. So if we can keep it from progressing and keep you stable, that's a win. Symptom management, very, very important. But what's really important is that you know your symptoms. Nobody knows your MS better than you. Don't ever, ever allow somebody to tell you about your MS. It's your job to tell us about your MS. So it's important for you to know what your symptoms are, when you have symptoms, whether they bother you, when they bother you, and if you want those symptoms addressed to improve your quality of life. Also, management of other comorbid factors. By comorbid factors, we're talking about other medical conditions and other bad habits. Those things really, really impact how successful your MS journey is going to be. So it's really important that you manage successfully high blood pressure, high cholesterol, diabetes issues, any other autoimmune conditions. It's also important that you have a healthy lifestyle. Smoking is a no-no. We know that smoking is bad for the nervous system. Healthy diet. It doesn't mean necessarily eating pounds of kale every day. It means having, being mindful of what you put into your body, because if you treat your body like a temple, it pays you back in spades. And it's important for you to put good fuel in your body, just like you do with your car. So I say to people, eat as much color and crunch as you can, 30 grams of fiber a day, 2 liters of water a day. And people look at me like, there's got to be more to it than that. But if we all did those 3 things and we focused on good sleep habits, we'd all be in a much, much better state of health. When you have MS, those things really, really impact your success with living with MS. Mental health has really become a big focus as well. And mental health and stress reduction is a really important part of your wellness program as well. You can't get stressed about being stressed because life is stressful. But it's a matter of setting boundaries It's a matter of being in charge of your energy output in the course of a day, whether that's physical energy, mental energy, doing things to keep yourself a little more organized, management of fatigue, all of those things, really, really, really important for you to be successful and to live a successful life with MS. So some thoughts about MS in African Americans with MS. There's really been very, very little guidance in terms of all the medicines we have and how non-whites are going to respond to these medicines, because there's been very, very poor representation of Black MS in our clinical trials. Most of the clinical trials for the medicines that are on the market have a huge, huge proportion of people from Eastern European countries, even within the US populations, very, very little in terms of Black, Hispanic representation. So we really don't have a lot of data about whether or not we're going to have the same outcomes treating with a particular medicine in a Black and a white population. And that's starting to become a very important part of some of the more recent clinical trials, looking at biomarkers, signs in the bloodstream of quieting down nervous system destruction, or whether we're actually doing a good job of keeping that nervous system debris or trash at bay. And that's something that we can check now with a blood test. We can look at biomarkers to see if we're doing a good job and you're having the same response to a particular medicine. For instance, we know that with ocrelizumab, we know that African Americans tend to have their B cells, which we're wiping out with that medicine, come back much sooner than white people who are on that same drug. So we know that there are some differences. And this is not a novel concept. We've known for a long time with high blood pressure, for instance, that for Black hypertension, we use a certain class of antihypertensive medicines than we do with whites. If it's a white person with high blood pressure, they're started on a different class of medicines as their first medicine. So this is not a brand new thought. This is something that we have been very familiar with in medicine and other aspects of medicine. We also know it's very important that your treatment is personalized for your MS. I've been saying this over and over. Your MS is your MS. There's nobody else's MS that is the same. So we can't treat people exactly the same. My job would be very, very boring if everybody was treated the same. But your MS calls for attention to different details than the next person. So personalized treatment is very important. And it's important that we follow how you do while you're on a particular medicine. So you have to give feedback in terms of, are you tolerating the medicine? Do you have side effects? Because if you have side effects, we have so many medicines to choose from, then we have to think about doing something different. No longer do we want you to, or you shouldn't have to feel worse from a medicine than your MS. So if you do, then there are lots of options to talk about. We also use MRIs to predict how somebody's going to do, and we use MRIs to follow somebody while they're on medicine. It's important to make sure that even though you're okay clinically and you have nothing new to tell us, it's important for us to know that the MRI is staying quiet and that there are no changes, and that you are, in fact, very, very stable. It's important to have kind of a confluence of what you have to say, the neurological exam, and the MRI scan. If all of those things are boring, as I say, that's the highest compliment I can give somebody. If those things are unchanged, then we know that you are, in fact, stable. If somebody has no complaints, they have no relapses, but they come in and my exam is a little bit different, or there's a change on the MRI scan, that means we need to do something different because we're not doing the very best that we can at keeping your MS stable and quiet. So it's really important for you to be very aware of your MS. So how can you be the very, very, very best person with MS and really be a part of a very successful journey of having MS? It's, again, the focus is on you and your MS, and nobody nobody can know your MS better than you. So it really is important that you understand your MS. Be prepared for your medical visits. You have to remember that you are a consumer of healthcare. So that is your time. That is your precious time with your healthcare team. And you need to come prepared so that, in essence, your appointment isn't hijacked by your healthcare provider. Because if you don't come with an agenda, then we most certainly will. So for you to understand your history, to have some notes of things that you really want to discuss and have addressed, what your medicines are, what they're for, how often you take them. These things just really facilitate the best care that you can have. Advocate for yourself. It's really important that you get your needs met, that you are able to prepare them and to present that, and that you get those things addressed, that your questions are answered and you have a good understanding. For you to be educated, and that's what this summit is all about. That's why you're here, to be educated and to understand MS, understand differences in MS, understand how your MS is different and your needs, to become part of the MS community, the National MS Society, things like this, programs like this that are really help you learn how to be an advocate, learn how to understand MS, understand your treatment options. Those things are really, really important. And lastly, it is very important to allow help if you need it and to ask for help if you need it. You know, a lot of times people think that asking for help, getting help, needing help is a sign of weakness. And it's not. I think about things as being enabling. I push people really hard to get a handicap placard, because why would you want to use all your energy up just to prove that you can walk to your car a half a mile away when it's 100 degrees outside, and then you're toast for the rest of the day? Let's have you be in charge of your energy expenditure. So yes, a handicap placard. Yes, something to help you walk in a more stable manner and to be able to walk further, longer, safely. These things are all enabling devices. But when people want to help you, it really makes people feel good to be able to help you. So keep that in mind when you're interacting with your family. It's important for you to discuss with your family what your needs are and what your MS is like, just so people have a better understanding as well. No, again, nobody knows your MS better than you. So I'm going to wrap this up by saying thank you so much for being a part of the summit. And I hope that I've been able to give you a little bit of MS 101 to start your summit off. And I wish you much success in your MS journey. Thank you.